The new year has brought a wave of illness to China. As the world celebrated the arrival of a new year, China was grappling with a sudden surge in hospital admissions. The bustling streets and vibrant celebrations were overshadowed by a growing health crisis. Hospitals are seeing more patients, many struggling to breathe, emergency rooms are filled to capacity, and healthcare workers are working around the clock to provide care. The scenes are reminiscent of the early days of the COVID-19 pandemic, with patients on ventilators and medical staff in full protective gear. This time it's not COVID-19 causing the surge. The familiar fear of a respiratory illness has returned, but the culprit is different. Doctors and nurses are on high alert, trying to manage the influx of patients while also protecting themselves from infection. A different virus, Human Metapneumovirus or HMPV, is spreading quickly. This virus, though less known to the public, is causing significant concern among health professionals. HMPV is known to cause respiratory infections, particularly in young children, the elderly, and those with weakened immune systems. Chinese health officials are working to understand the outbreak and stop its spread. Teams of researchers are analyzing samples, trying to trace the virus's origins and understand its transmission patterns. Meetings are held daily to coordinate the response and implement measures to contain the virus. The situation is a reminder that the world is still vulnerable to infectious diseases. Despite advancements in medicine and technology, new viruses can emerge and spread rapidly, challenging our preparedness and resilience. The global community watches closely, aware that an outbreak in one country can quickly become a global issue. After years of battling COVID-19, China faces a new health challenge. The memories of lockdowns, travel restrictions, and overwhelmed healthcare systems are still fresh. Now, the country must mobilize once again to protect its citizens and prevent another widespread health crisis. The coming weeks will be crucial in determining the severity of this outbreak and its potential impact beyond China's borders. Health officials are urging vigilance and cooperation from the public. International airports have increased security measures, and countries around the world are monitoring the situation closely. The hope is that with swift action and global collaboration, the spread of HMPV can be contained, and the new year can proceed with health and safety for all. Across China, hospitals are reporting a sharp increase in patients with respiratory illnesses. The scenes are reminiscent of the early days of the pandemic, with waiting rooms filled to capacity and hallways crowded with patients seeking urgent care. The situation is becoming increasingly dire as more and more individuals present with severe symptoms. Emergency rooms are overflowing and hospital beds are in high demand. The sheer volume of patients is overwhelming the healthcare system, leading to long wait times and a shortage of available beds. Many patients are being treated in makeshift areas, such as hallways and temporary tents, as hospitals struggle to accommodate everyone. Many patients are experiencing fever, cough, and difficulty breathing. These symptoms are putting a significant strain on medical resources, as healthcare workers try to manage the influx of cases. The rise in respiratory illnesses is particularly concerning as it coincides with the flu season, compounding the challenges faced by medical staff. Doctors and nurses are working long hours to care for the influx of sick individuals. The relentless pace is taking a toll on their physical and mental health, with many healthcare workers reporting burnout and exhaustion. Despite the challenges, they continue to provide critical care, often going above and beyond to ensure patients receive the treatment they need. The surge in cases is putting a strain on China's healthcare system. Hospitals are operating at or beyond capacity, and the demand for medical services is outpacing supply. Healthcare workers are stretched thin, and the pressure is mounting as they try to keep up with the growing number of patients. Hospitals are facing shortages of medical supplies and staff. Essential items such as masks, gloves, and ventilators are in short supply, making it difficult to provide adequate care. The lack of resources is exacerbating the situation, leaving hospitals struggling to meet the needs of their patients. The government is deploying additional resources to help hospitals cope with the outbreak. Efforts include distributing medical supplies, setting up temporary medical facilities, and mobilizing military personnel to assist with the response. These measures are aimed at alleviating some of the pressure on the healthcare system and ensuring that patients receive the care they need. Human Metapneumovirus, or HMPV, is a common respiratory virus. It typically causes mild, cold-like symptoms in most people. However, HMPV can be more serious in young children, older adults, and people with weakened immune systems. In these individuals, HMPV can lead to pneumonia, bronchiolitis, and other complications. There is no specific treatment for HMPV. Treatment focuses on relieving symptoms and supporting the body's immune response. Rest, fluids, and over-the-counter medications can help manage symptoms. In severe cases, hospitalization may be necessary. The Chinese government is taking the HMPV outbreak seriously. They have implemented measures similar to those used during the COVID-19 pandemic. These measures include increased testing, contact tracing, and isolation of infected individuals.
The government is also urging the public to take precautions to prevent the spread of the virus. They are recommending mask wearing in public places, frequent hand washing, and social distancing. Schools and businesses are being advised to implement hygiene protocols. The HMPV outbreak in China has raised concerns about a potential global threat. The virus's rapid spread and the potential for severe illness in vulnerable populations have health experts worried.
The World Health Organization, or WHO, is closely monitoring the situation. It's, too early to say whether this outbreak will become a pandemic. However, the situation highlights the importance of global health security and international cooperation in responding to emerging infectious diseases. Section 6. Life in China, Masks and Memories. In this chapter, we delve into the profound impact that recent health crises have had on the daily lives of people in China. The sight of masks has become a symbol of resilience and caution, a reminder of the challenges faced and the collective efforts to overcome them. For many in China, the HMPV outbreak brings back memories of the early days of the COVID-19 pandemic. The empty streets, the long lines at health checkpoints, and the pervasive sense of uncertainty are all too familiar. These scenes are etched in the collective memory, serving as a stark reminder of the fragility of normalcy and the importance of vigilance.
Masks are once again a common sight on the streets. In crowded markets, on public transportation, and in bustling city centers, the presence of masks signifies a community's commitment to safeguarding health. It is a visual testament to the lessons learned from past outbreaks and the ongoing efforts to prevent future ones. People are being more cautious about social gatherings and taking steps to protect themselves and their loved ones. Socially distanced outdoor gatherings have become the norm, and families are seen wearing masks while shopping. The use of hand sanitizer has become a routine part of daily life, reflecting a heightened awareness of hygiene and personal responsibility.
The outbreak is a reminder that the threat of infectious diseases is ever present. Medical professionals in hazmat suits, laboratory staff diligently testing samples, and the bustling activity in hospital settings all underscore the ongoing battle against invisible enemies. These images highlight the tireless efforts of healthcare workers and the critical role they play in safeguarding public health. It is a stark reminder of the importance of public health measures and individual responsibility in preventing the spread of disease. Public service announcements emphasize the need for vigilance, while health workers distribute vital information to the community. Individuals are seen sanitizing their hands, a simple yet powerful act of prevention. Together, these efforts form a collective shield against the spread of infectious diseases, illustrating the power of unity and shared responsibility in protecting public health. Section 7. The importance of preparation, not panic. While the HMPV outbreak is a cause for concern, it is important not to panic.
Health officials are closely monitoring the situation and taking steps to contain the virus.
The public can play a role in preventing the spread of the disease by following public health guidance.
Staying informed about the outbreak, practicing good hygiene, and getting vaccinated against other respiratory illnesses such as influenza can help protect individuals and their communities. Section 8. Staying healthy in an uncertain world. The HMPV outbreak is a reminder that we live in a world where infectious diseases can emerge and spread rapidly.
It is essential to prioritize our health and well-being. This includes taking steps to boost our immune systems, such as eating a healthy diet, getting enough sleep, and managing stress.
By taking care of our physical and mental health, we can better equip our bodies to fight off infections and stay healthy. Section 9. A global effort for global health. the HMPV outbreak underscores the interconnectedness of global health.
Infectious diseases do not respect borders, and international cooperation is crucial in responding to outbreaks and preventing future pandemics.
By working together, sharing information, and supporting each other, we can strengthen global health security and protect the health of people around the world.